Step-by-step protocol for self-observation and cognitive correction in narcissistic personality disorder. Today, we will explore a step-by-step protocol for self-observation and cognitive correction that can be applied in narcissistic personality disorder. This method is based on evidence-based approaches from cognitive behavioral therapy, schema therapy, and current neuroscience findings. The main issue in narcissistic personality disorder is a lack of self-reflection and difficulty regulating emotions appropriately. Neuroimaging studies show that these patients often exhibit increased amygdala reactivity, responsible for processing threats, along with decreased activity in the medial prefrontal cortex, which is involved in cognitive control and self-awareness. As a result, the person reacts impulsively, often in ways that are destructive to themselves and others. The self-observation protocol helps interrupt this automatic response. Its goal is to record the sequence of events, interpretations, emotions, and reactions, and then gradually integrate new, less destructive behavioral patterns. Step 1. Self-observation. All work begins by identifying the trigger. It is important to note the exact time, context, and emotion experienced. For example, 10:30 a.m., a colleague made a comment, "I feel anger and tension." At this stage, there is no need to analyze the situation, simply record the fact. Recording the event itself initiates a cognitive pause. Instead of an automatic reaction, you bring the response into conscious control. Step 2. Deconstructing the reaction using the ABC model. This method was proposed by Aaron Beck in cognitive behavioral therapy. A activating event. B. Belief, interpretation or thought. C. Consequence, emotional and behavioral outcome. Example. A colleague made a comment. B. They want to humiliate me. I am not good enough. C. Anger, desire to belittle them in response. The patient's task is to break down the reaction into these three components. This dismantles the illusion that emotions arise spontaneously. In reality, a belief always comes between the event and the reaction. Step 3. Evaluate facts versus interpretations. Here, it is crucial to separate objective facts from subjective interpretations. Fact: the colleague made a comment. Interpretation: they think I'm incompetent. At this stage, cognitive distortions are identified, such as catastrophizing, exaggerating negative consequences; mind reading, assuming we know what others are thinking; personalization, perceiving neutral events as personally directed. Recognizing and recording these distortions reduces their power. Step 4. Corrective behavioral alternative. At this stage, principles from Jeffrey Young's schema therapy are applied. The goal is to form a new reaction pattern that is more adaptive. For example, instead of automatic devaluation and aggression, acknowledge the emotion and label it. I feel anger because the criticism is unpleasant. Then choose a conscious alternative, accept the mistake and calmly correct it. The key is repetition. A single application won't change the pattern. But with regular practice, a new cognitive route develops, engaging the prefrontal areas of the brain and reducing impulsivity. Clinical example. Patient M, 42 years old. Recurrent pattern: outbursts of aggression in response to colleagues' criticism. Trigger: being pointed out for a technical error. Initial reaction: desire to humiliate the interlocutor. Applying the protocol. Record the trigger, comment, anger. ABC analysis: event, comment, belief, they are trying to devalue me, consequence, aggression. Separate fact from interpretation: the comment objectively relates to an error, no personal attack was intended. Form an alternative, accept the mistake, correct it, maintain professional relations. After 3 weeks of systematic practice, there was reduced conflict at work and improved interpersonal climate. Conclusion. The self-observation and cognitive correction protocol is an accessible and free tool. It can be performed independently without constant supervision from a psychiatrist, provided the person is disciplined and committed to systematic practice. The algorithm is simple. Record the trigger and emotion. Break down the reaction into event, belief, and consequence. Separate facts from interpretations. Choose and reinforce a corrective behavioral alternative. This method does not replace professional therapy but significantly reduces destructive automatic reactions, improves quality of life, and preserves social connections. Remember, consistency is more important than intensity. Even if you perform this protocol once a day, consistent practice will accumulate results. You not only save on expensive psychiatric visits but also invest in your own future. Start today. Self-observation is the first step toward change.